This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. LaFredo, and this week we are on location. We are at Journey Church on Bank Street in Kingman for the 7th annual Breast Cancer Survivor Luncheon. And with me is Teri Williams. She is the Director of Communications and Marketing, also of the Catch It Early program. And hey, Teri, welcome back.
Hi.
I want to talk a little bit about what we're going to hear today. We're going to capture some audio from the presentations and from some of the speakers that you have. Tell me a little bit about this Cancer Survivors Luncheon.
Well, we started this, of course, 7 years ago. This is the 7th annual, to mainly just bring together a lot of people who have been through a hard time. We call them cancer survivors. And we celebrate strength, we celebrate courage, we celebrate that we're all here to celebrate. So we've been doing it for 7 years. It's grown. We'll have probably 150 cancer survivors here today, and along with a chosen person that usually their spouse or a friend who supported them through their cancer experience. So it's a time to come together and to reflect on what we've been through, but also to celebrate that every bit of the experience is usually something that builds a lot of character in people, and to bring those people of that type of character together is quite an event.
We've talked a little bit about this before, but you and I, well, we're not doctors. We can't help people through situations in a medical sense, but what we really do care about, or one thing we really care about, is the storytelling. Mm-hmm. And I always think about how powerful stories can be and how they can help carry us through some of those times when we really need a voice.
Mm-hmm. And that's what we'll have here today is survivors telling their story. And again, not from a sense of what I've been through or whatever, not a modeling approach to it, but more of what cancer has done. And for a lot of people, it's surprising to talk to cancer survivors, the insights it's given them, the appreciation for little things and also for great things. And it's usually a very positive group, and those stories by those survivors encourage everyone.
Teri, I know you got to get up on stage, but thanks so much for just a moment of your time, and thank you for all that you do for the community.
Thank you, TG, and I appreciate all that the people that are out there that are supporting cancer survivors. I also appreciate all the caregivers in the medical field, and we're making a lot of progress. It's a very good thing. Good afternoon, everyone. So wonderful that you're here and braved the weather, and we would like to welcome you to the 7th annual Breast Cancer Survivor Luncheon. Hopefully today you'll have a few laughs, hopefully not too many tears. We're not going to do tears, but also just some time together to kind of share our experiences and rejoice in life. So, my name is Teri Williams. I am the Director of Communications and Marketing at Kingman Regional Medical Center. I also am, I guess I'd say, manager of the Catch It Early program at KRMC. And I'm a breast cancer survivor. I'd just like to explain a little bit about the purpose of this luncheon. First is to support and encourage people who are currently battling cancer. Most of us in this room know what that's about. And so as survivors, we're encouragement. That's all there is to it. The other thing is to admire the strength and courage of those of you who have survived cancer. It is to put it lightly, a character building experience. And also to thank the loved ones and the caregivers that support people who have cancer. And we have also a lot of those in the room. And lastly, to honor those who have passed from cancer. And I said lastly before, but actually lastly is to celebrate life and the simple joys that all of us experience. So I'd like to introduce our survivors first, all of you. However, I want to define what survivor means. To beat the odds, one with great courage and strength, a true inspiration. And that is definitely a definition of survivor. But when does being a survivor start? Are you a survivor after you've been cancer-free a certain amount of time? In the medical world, the way we define survivor is you are a survivor from the first moment you learn you have cancer. That is a survivor. And those of us who have gotten that news know what I'm talking about. And so anyway, I would like to first have our survivors, everyone who is a survivor of cancer, doesn't have to be breast cancer, any cancer, please stand. Okay, we salute you. Those of you who are caregivers or have ever been someone that helped someone else through cancer, whether it was an encouraging word, a prayer, please stand. That's everyone here. We thank you. We thank you. So with that, I would like to introduce Brian Turney, who is the CEO of Kingman Regional Medical Center, to say a few words. Brian?
Hi, good afternoon. Thank you for coming. It's neat to see you here. First, I want to do a couple other thank yous, if you don't mind. I'm going to be brief with my comments, but Teri and the PR group, I think they do a wonderful job. Would you guys just stand and wave? Everybody. Some of the guys are in the back there hiding out, but I really appreciate them doing this. And and if you don't know Teri's story, she's a survivor, and I just love the passion that she has. I mean, this would not be happening to the degree it's happened in Kingman if it weren't for Teri and her passion for just making this happen. There's a lot of work that takes place, and just really appreciate her doing that. So thanks, Teri, appreciate it. So. I would like to recognize the physicians over here at the table here that I was kind of joking around with. I'm going to introduce Dr. Rivera here in just a minute, and Dr. Johansen is going to be speaking, but Dr. Alleman, he's sitting there on the right, Dr. Wade Alleman. He's actually one of the beginning guy. He was the first radiologist with our radiology group, and I don't know if you're aware, all of them came from Mayo Clinic Rochester. They started, but the genesis was Wade and Dr. Bodley at the beginning, and Chris was actually was with them and interviewed, and he ended up doing a fellowship in women's imaging, so he came a year later. But that's really the genesis of a lot of this that took place. So Wade, even though you're not going to speak, we still love you. So and thanks for coming. I'd like to introduce Dr. Rivera, and have some, I'll just read what it is here, but I will share with you also. I was talking with Dr. Rivera, and in fact, I don't know if you're aware, at the hospital, I send out what are called Living Our Mission emails. And yes, we get complaint letters at times, but we get a lot of positive letters, and a lot of times those don't make the newspapers and other things. So I send them out to our staff, and I call it a Living Our Mission email. So our staff gets to see all of that positive feedback. I think that's important for our staff when they're doing good things to be able to see that. So, in fact, I just sent one out this morning. It was some comments about Dr. Rivera, about a patient was talking about the care that they received and how wonderful Dr. Rivera and the Cancer Center was in taking care of them. So, and the other thing I tease Ed about, I says, Ed, people like you, and they also, a lot of ladies think you're good looking. So I just so anyway, give him a hard time when he comes up. So, but I'll read the official stuff here. As a medical oncologist, Dr. Rivera specializes in managing the care and treatment of people with cancer. He brings extensive expertise from over 26 years experience as a renowned cancer treatment hospitals. Received his doctorate in medicine at the University of Puerto Rico in San Juan, Puerto Rico, and completed his internship and residency in internal medicine at the University of Texas Science Center in San Antonio, Texas. He then completed a 3-year fellowship in medical oncology at the University of Texas MD Anderson Cancer Center in Houston, Texas. And I think hopefully you know that that's a world-renowned place. He served for time as medical director at Methodist Hospital's Breast Center in Houston. And prior to coming to Kingman, he served as the medical director of the prestigious Banner MD Anderson Cancer Center in Gilbert, Arizona. We're really happy to have Ed with us and serving the patients in the community. So with that, I'd like to introduce Dr. Rivera.
I think I've been embarrassed enough already for the whole day. So I'm already flushing here. So, last year, actually, 2016, it was about 20 years since I started practicing oncology. And people always ask me, why oncology can be so depressing. But I love oncology. I absolutely love it. I started my love for oncology, I think I mentioned this last year. My brother actually passed at age 30 of malignancy, of what they call germ cell tumor, very rare tumor, not very common. He was diagnosed when he was only 26, and unfortunately 4 years later passed. So, and then later on, a few years later, my dad died of cancer as well. So I've always had a passion for oncology. I'm a healer. I always say, like Michael Jackson says, I'm a lover, not a fighter. So I just love dealing with oncology patients, with cancer patients. It's always the side of having to give bad news to the patient. I hate that about my job. I always tell them, I just don't like that part of my job. But I love coming to, places like this and events like this, where there's so many of you, so many survivors. So that part I really enjoy. So, and I'm hoping I will enjoy it for whatever time it is that I'll continue to practice oncology. This is actually my 3rd year in Kingman. I don't know if you guys knew that. So, and it's been great. It's been great being part of the KRMC family, being part of Kingman. Love the patients. Seeing a lot of changes since we started. We had to modify certain things, change some things around. We've been able to bring a lot of new things, new drugs. Some of you actually being able to be part of that. And I think we're going to continue to see more changes as the year go by, and hoping that we'll be part of that as well.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Teri Williams, Dr. Christopher Johansen, the Medical Director of KRMC Breast Imaging, and Janet Watson, who's the former mayor of Kingman, the current president of the Kingman Cancer Care Unit, and a 5-month breast cancer survivor. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. We at KRMC want to wish you a Happy New Year. Over the past 12 months, we have grown and evolved, just like the community we serve. We look forward to serving you and your family in the year ahead. Here's to a happy, healthy 2017. KRMC.
The biggest barrier to getting care is the cost of the care. And so we started 2 years ago providing free mammograms to every woman in Mojave County who's 40 or over through this program. Now, of course, when we say free, if you have insurance, we'll bill your insurance. But if there's any out-of-pocket cost, it's covered through this program. In just 2016, and Shauna helped me because I didn't bring it with me. There were, how many did we screen? We screened over 6,000 women through this program. With that, there were over 70 who had breast cancer. In some cases, had it not been for that free mammogram, they wouldn't have come in and we wouldn't have caught it early. And so we're literally saving lives through this program.
And welcome back to Focus on Your Health. I'm T.G. LaFredo, and this week we are on location. We're at the Journey Church in Kingman for the 7th annual Breast Cancer Survivor Luncheon. You just heard Teri Williams talking about the Catch It Early program and the importance of catching breast cancer early. This program allows uninsured and underinsured women to get their yearly mammograms, regardless of their ability to pay. For more information, you can call the KRMC Imaging Center at 692-2727. That's 692-2727. And we're just about ready to turn the microphone over to Dr. Christopher Johansen. He's the Director of Breast Imaging at KRMC.
Hello everyone, I'm Chris Johansen. I'm a radiologist at KRMC, and I have to say, I was so happy when Ed got here to have someone as great as him to be able to send my patients to after I diagnosed a cancer in them. But I'm really glad I get to see patients first, because now I know what it's like to have to follow you. And I'm really happy that for most of my patients, they meet me first and then you, not the other way around. It makes it a little bit easier for me to be impressive, I guess, if I'm not compared to you. But no, it has been great. Ed is part of our whole breast team here, and we're really lucky that we've been able to build such an amazing team. I'm just seeing some of the folks from our imaging center. Maybe you guys could stand up real quick. I was on the other side of the room, so I didn't get to see you when we made you stand before. But it really is, yes. It's just really great to have such a team of people, especially nowadays. Medicine is not the result of one doctor or one person. It's a team of people working together, and I'm so happy to be part of the team that's been assembled at KRMC. And I have to thank Brian Turney, because all of this is possible because we have such heavy support from our hospital. We're the only nonprofit hospital in Mojave County, and when it comes to getting new equipment, getting the things we need to be cutting edge, it really shows that we get their support. So I really thank you very much. None of what we built would be possible without the administration supporting us and making sure we have all the tools we need. I look forward to this every year, because I don't get to see people like Ed does after I diagnose them. I get to know people. We do biopsies, things like that, and after that, I still see your picture when you come back for follow-up imaging, but I don't typically, unless I have a chance, I'm not able to come out and say hello to people and see everyone after everything's been treated and they're doing well again. So I love coming here, and I love seeing the energy and just the results of these programs that we've got here, helping people, getting people back out into our community to continue enjoying their lives and contributing to everything we have here in Kingman. So thank you for coming out today and for being a part of our community and just for supporting us so we can continue to help people all over the county and improve our breast cancer detection program. Thank you.
So next I'd like to introduce the president of Kingman Cancer Care Unit. She's also our past mayor, and just recently, 5 months, we printed it wrong, breast cancer survivor. So she's here to talk to us about that.
Well, I was going to start out. I know my talk's going to be very short because almost every point has been covered. But first of all, I was going to say I was here last year representing the Kingman Cancer Care Unit as the president. And I had been once before to speak when I was the mayor. But you know what? God works in mysterious ways, because I can't tell you how that impacted my life when I learned that I had breast cancer a few months ago. because I kept thinking, I saw all those survivors there. I saw all those survivors there. And it was such an uplifting time. And I remember Betty Lawrence talking and the other people that spoke, that it gave me so much strength and courage. So I don't know if you were here last year, but the ones of you were. It was very, very uplifting. And so I'll say, I'm back again. I'm still the president of the Kingman Cancer Care Unit. And we just had a meeting earlier this week, and to follow up on what Teri was sharing, we expended, whatever you want to call it, on patients over $72,000 in 2016. And that's all by donations and fundraisers. And as you know, we have no office, we have no location, we have no payroll. We are 100% volunteers in what we do, helping people in the Kingman area with their costs and expenses. So I'm back this year, but this year I'm coming as a cancer survivor. So I want to share some of the things I've learned along the way and how I've felt during the process. Not everything was pleasant, but you know what? Everyone was always kind and always thinking about me and my best interest, and I'll never forget that. I just want to say that I feel like I am very blessed. I think I told Dr. Rivera and his medical assistant, Jeannie, I don't know if she was in the room or it was somebody else. I said, you know what? Since I've learned what I've learned in the situation that I've been, I said, I'm the luckiest girl in the world. And they kind of looked at me. It's not anything I would choose, but I'm dealing with it. I'm in the best place with the best doctors and the best equipment, and I feel very confident that they're going to watch after me. And I truly, truly mean that. I feel stronger. I have more courage and more faith and more joy because the people like you, from the friends who've been by my side, from the many, many prayers that have been given, the cards I've received, the phone calls, I feel like I have such an inner strength that it's just amazing, and knowing that the care that I'm receiving. So with everyone's encouragement and support, I feel like I am very blessed. I have never felt like a victim. This happens to a lot of people. I have never really felt afraid. I know that Teri was kind of worried about me and nervous. I'm okay. There's not a single thing I can do today to change the situation I'm in, except seek the very best care that I can and find out what my choices are for follow-up care, and on and on and on. So we can't undo what's already done. And nobody struck out and say, okay, you'll have cancer, but you're okay and you won't. I'm not a victim. I'm just one more person that is facing the situation that so many of you in this room are facing as well. So I've come to think about a lot of things in a broader scope. You know, I realize that all of us are terminal. We can either think about dying or we can think about living. And so I would just say, let's make every day count. And I want to thank Teri again for this wonderful, beautiful luncheon and the friend that she is to me. And let's all come back next year. Thank you.
And that's the show. My thanks to Teri Williams, Director of Communications and Marketing and the Catch It Early program at KRMC. Thank you to Brian Turney, CEO of KRMC. Thanks to Dr. Edgardo Rivera, Medical Director of the KRMC Cancer Center. And to Dr. Christopher Johansen, Medical Director of Breast Imaging. Thanks also to Janet Watson, who is the former mayor of Kingman, the current president of the Kingman Cancer Care Unit, and herself a breast cancer survivor. And as a reminder, every woman in Mojave County can receive an annual mammogram, regardless of ability to pay. For more information, call the Imaging Center at 692-2727. That's 692-2727. I'm T.G. LaFredo. Thank you for listening. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. We'll catch you next week.